All right, everybody. Well, welcome back. We're going into our last session with Amy Heffner here in a moment. But just a couple things. Number one, I went ahead and shared my screen with you. So I had some questions regarding where were the downloads for the sessions. What you're going to do is you're going to go to Auditorium. You're going to click on that button there. And at the bottom of each session, there's going to be a link in the bottom left-hand corner. And so for Amy's notes, you can find that here by clicking on that button. And so you'll find it on most of them, but you'll see that some were not originally provided by the deadline that I needed to post them. And so if I know like Sharon had shared that she would share hers, Mary had mentioned that she would share hers. And so so those will be things that once I receive them, I'll make sure to pass them on to you. If you're looking for yesterday, you just click on day one and you'll see here's Amanda's notes. We have Peter's notes, Heather's and Mindy's. So hopefully that answers your questions about that. Amy's notes are not about DDA. Let me take a look. There's a chance that Luke made a mistake because we did a little bit of shuffling around the day before, and it's possible that it had the wrong notes. So I'll take a look at that after this. These will be available, Jamie, for 30 days. You'll be able to access this information or this website just by entering in your email address like you did today. And then over here, here's that sneaky surveys tab, request WSBA credit. And then here, conference feedback survey, if you wouldn't mind filling that out. We would really appreciate any feedback that you have. But as it comes down to, or with the conference ending, we have found our winners for the conference game. And so I have to announce those right now. Coming up in 5th place. And now and remember, it may have changed in the last couple of minutes. What I had said was at 2:45 exactly, I was going to take a screenshot. What my screen said after I refreshed it, that's who we were going to go with. And so with 410 points in 5th place, we had Tracy Raymond. In 4th place, we had Elizabeth Stone. In 3rd place, we had Sarah Tremblay. In 2nd place, we had Marlene Finchbridge. And in 1st place, I'm probably going to butcher your name again, but we've got Drew Keithan. And so congratulations. Drew, since you're in there right now, and I see a lot of the same people that we had last year. So you guys are hardcore. I love it. So we've got an iPad, we've got free conference registration for next year. We've got AirPods, we've got $200 off the conference, and then we've got a $50 Starbucks card. Drew, what do you want? Oh, it didn't even take any time. I just want the iPad. Okay. All right. So Drew, if it'll let you send me a direct, or if you can email me your address, and I'll make sure that we get that sent to you soon. So 2nd place, we had Marlene Finchbridge. Marlene, are you here? True. Okay. Yep. Fair comment. I was a little late on that. Marlene, so what would you like? So we've got the free tuition to next year's conference, the Apple AirPods, $50 gift card, or $200 off. Marlene, it's up to you to decide. Next year's conference. There we go. All right. And then, so in 3rd place, we got Sarah. Sarah, what do you want this year? You won free tuition to this year's conference. You have the option of $200 off, $50 gift card, or Apple AirPods. All right, we got the AirPods. Okay. Same thing with that. Sarah, if you wouldn't mind just emailing me your address, that would be awesome. Elizabeth, we got you at 4th place, $200 off or $50 at Target. 50. Well, I didn't say Starbucks, but hey, we could do a Starbucks card because I'm pretty sure $50 at Target would buy you like 3 cartons of eggs and a gallon of milk or something. So that seems like a better one. So $50 Starbucks card it is. And then Tracy, you're in 5th place. You get $200 off next year's conference. So congratulations, everybody. That's awesome. I am going to stop sharing. Am I still sharing? Yes, I am. So stop sharing. I'm going to let Amy start sharing here. And I will go ahead and introduce Amy, if I can pull up the right screen on my computer. All right, so in number one, so Amy is filling in graciously. We had somebody else who was speaking or was planned to speak and had a family emergency, and so with like less than 48 hours, Amy agreed to step in and give the presentation that was scheduled. And so let me share a little bit about Amy. Amy Heffner has worked in the field of developmental services for over 7 years. Originally, she's from Pennsylvania, where she served as supports coordinator. Amy relocated to Washington in June 2021. In Washington, she initially worked as a case resource manager with the DDA before transitioning to a role in intake and eligibility in 2022. Amy is passionate about meeting clients and their families at the front door and enjoys educating them along with community partners about DDA and the eligibility process. And so I will pass things on to you, Amy.
Thanks, Luke. Hello, everyone. I generally do these presentations alongside Doreen, so bear with me as I've never done this independently before. And so Luke and I talked before, and if you put questions in the chat and I don't address you, I'm hoping somebody, maybe Luke, can try and get to my attention, but I'll do my best to answer your questions as they're coming up. So here we go. So like Luke said, I work for the Developmental Disabilities Administration. I work under Doreen, who would have originally done this presentation, so I'm going to take over for her today. And can someone confirm that my slides are showing?
Yep.
Okay, thanks, Luke. All right. So what is a developmental disability? Here at the DDA, we define developmental disability as having originated prior to the age of 18, that it's continued to it's expected to be continuing, indefinite, that it's never going to end. It's also something that needs to constitute a substantial limitation to the individual. Substantial limitation would be an adaptive skills deficit. If it's other conditions, it might be physical assistance needs. And so it can't, there has to be some kind of deficit to the person's everyday living. The first step to the DDA eligibility process is the determination process. This is when an application is submitted to us. First is the application. It's either requested by somebody to be sent via mail, email, or we now have what's called Adobe e-sign. And so that allows us to send the application to families through the Adobe system. And then it makes very evident which parts of that application are required in order for it to be sent back to us. And so there are 4 forms that go out with the application if it's an adult client, one of which is the voter registration, which doesn't get returned to us. Oftentimes families return them to us, but it's actually supposed to be mailed to the address on the voter registration form. So that form is sent out along with the request for DDA eligibility determination. That form is like the demographic form. It tells us who the person is who's applying, who is their representative. And this form is super important to be filled out very thoroughly, top to bottom, every line. whether it applies or not. We need that form filled out in full. And if it doesn't apply, then NA is a perfectly good, acceptable answer to that question. The forms are available in other languages, not just in English. So those are accessible here at the office. We can forward them. We can send them that way through Adobe. They're also available in several languages through our website. So that is 14-151. That is the primary application form. If an individual has a guardian, and the guardian is the one completing the application for that individual, the guardian must sign the application and also submit the court order establishing guardianship. Oftentimes, we get an application and the guardian has signed it for an adult client, and then we can't start the determination process because they do not provide the guardianship letter along with the application. And so it's not considered valid till we have a copy of that guardianship letter. Along with that, the consent form. Guardians often sign the consent form because that's part of their role. The consent form is also a really big part of the application process, because if documentation is not provided, we can assist the applicant in requesting documentation. However, if the consent is not signed or completed properly, it's considered invalid. And so that consent form, it can be confusing to families because it has little check boxes next to the different areas that's required to be fulfilled. So schools, medical facilities, mental health providers. And so next to that is also a line. It's super important that that line contains who we are contacting. Oftentimes we'll get it, the boxes are checked, the consent is signed, but it doesn't say who we actually have consent to speak to, and therefore we can't use it and aren't able to help with requesting records until we receive a more complete consent form. That form is also available in other languages on the website through Adobe, as well as here at the office. We also have what's called a notice of privacy practices for clients. This is just your notification of HIPAA rights. So it's a few pages that include what the HIPAA rights are, and then there's a page that's acknowledging that that form was received. We don't need all of the pages back. We just need that last form that acknowledges that the notice was received. The notice is for you to keep. If it comes back to us, it can often get tossed because we don't need it. It's not a part of the packet. It's just your rights as an applicant, as a client of DDA. Then there are 2 additional forms we generally send out with the application. One is the eligible conditions specific to age and type of evidence, and then another one that's very similar. It's a little bit more colorful. And they just go over the 5 main conditions that we accept at DDA and the requirements underneath each of those conditions. So what kind of diagnostician do we require for that diagnosis? What substantial limitations do we need to see for that diagnosis? And then the ages that might be pertinent to different diagnoses under that age. Applications can be requested either the website that you see on the slide. You can go there. It's a service information and request web form. You fill it out with the information of the client who's applying. You'll put the main contact person. So generally with guardians, they list themselves. And then you'll put, there's a little box that says, do you need an application? And then you'll hit yes. And then there's a comment box that you can fill out and put any questions or any thoughts in there that you would like to convey through that web form. And then a support staff will either contact you if they have questions or send you an application directly, whether that's through the mail, through email, or through Adobe. Applications, however, can also be obtained through the email or calling the DDA office. So if you have a DDA office in your area, you can call that office and request an application be sent. Sometimes they'll connect you right to one of us in the I&E department, and then we will confirm that's why you're calling, and we'll have the support staff forward an application to you. There's also an email address that I can put in the chat for you guys, but this is how applications can be received through email. You can send an email to this email address and then request an application, and they will get back to you. So DDA R3IE. Yep. So that email address is directly to our I&E inbox. It's seen by our supervisor as well as our support staff. And so they can process and send applications to you through that as well. All right, so this next slide goes a little bit over the conditions that we find people eligible under, as well as the age ranges for each of those conditions. About a year ago, we had a change to the WAC, and we are now able to find individuals eligible under developmental delay until the age of technically 19, because at 20 is when that condition expires. And so this chart has recently changed. And so we're now able to find those individuals eligible under developmental delay as well. All right, required documentation. So this is one that we often have a lot of questions about because it's different for every diagnosis. When it comes to developmental delay as a qualifying condition, we don't need evidence of diagnosis. The evidence for that condition specifically comes from finding the 3 areas of delay that are required for individuals over the age of 4 and up. So that one specifically does not have requirements for diagnostic information. However, all of the others do. And so we start with diagnosis. We need an eligible condition to find somebody eligible outside of developmental delay. So that's where we start because we can't move forward. You don't see the email. It should be in the chat. I don't know. Is my chat not working?
It's showing up for me.
Okay. Perfect. All right. I can send it again, Nanette, if it doesn't show up for you. So required documentation. The diagnosis is the main portion. We start there. We tried to get a diagnosis. And so we'll look for an eligible condition. Oh, it says that it's addressed to everyone. I will, thank you, Luke. All right. Again, the diagnosis itself is dependent upon the condition under which you're applying. And so on the application, to go back a little bit, when applying for DDA, there's a portion of the application itself that asks what condition under which you're applying. And it's super helpful for those of us who process applications that there's clarification added onto that application about what the diagnosis is. So conditions like autism and intellectual disability and cerebral palsy, epilepsy, they're very clear, and that's what the diagnosis is. But when it's the neurological condition or the chromosomal condition, having clarification on what we're looking for when we're looking at documents. So writing it on the application, what is that genetic condition? What is the chromosomal condition? What is the individual's neurological condition that you're applying under is super helpful, because looking through documents, it's not always very clear what we're looking at for eligibility purposes. And so diagnostic documentation is very dependent upon what that diagnosis is. And so it has to show the diagnosis itself and that it's not expected to improve or go away. That documentation also needs to show that the condition existed prior to age 18. Now, that's a broad category because there are 2 diagnoses that we accept that have onsets requirements prior to the age of 18, even more so. So for cerebral palsy, the onset has to be shown to be prior to 3 years old. And for autism, the onset needs to show that it was prior to 5. So the condition needs to exist prior to 18 for both of those. However, there needs to be an onset of much sooner in life in the documentation. In addition to the diagnosis and showing that the condition existed prior to 18, we also require evidence of substantial limitations. And like I mentioned before, this varies based on condition, but in overall general scope of them is IQ scores, physical assistance needs, and adaptive skills tests, which are often generated from school evaluations or other psychological reports. This is the colorful document that we send out with application packets. It does not include developmental delay, like I said before, because that is we don't require diagnostic information for that one. So it includes our 5 main categories. And it tells you the diagnosis that we actually look for when we're looking at documents, the diagnostician that is accepted for that diagnosis, as well as the substantial limitations specific to that diagnosis. For IQ specifically, and I know there's probably a lot of chatter in Washington State regarding IQ. Currently, IQ is still a required criteria. It will be discontinued as a disqualifying factor. We don't have a specific time frame. We are being told July 2025, but with the way the legislature works, it could be sooner. We're not entirely certain. So currently, IQ is still required. And these are the accepted IQ and adaptive assessments that we take. To note that there are nonverbal tests that we do accept that are different than the full scale IQ testing, and it's listed this way on in the WAC online. I want to note the adaptive assessments, the one that's abbreviated as ICAP, that is not an assessment that outside providers can complete for applicants. That is an adaptive assessment that we do here at DDA, but there is criteria that must be met before we can even do an ICAP. So it's not something we can go right to. There is criteria that must be met first. The other three, the Vineland, the CIBR, and the ABAS, are all ones that can be completed by outside professionals. This is just another slide that goes over the WAC about the IQ requirements. The WAIS is not on the list. So the WAIS isn't accepted. So the WAIS falls underneath the Wechsler intelligence scales. So it is an accepted IQ test with regard to the need for full scale IQ. So some of these, because it can be confusing, some of them don't list every test available that was done. So the Wechsler has several different age range of tests, and it kind of changes the name of the test. So the Wechsler, the WISC, which is for the children, the WAIS, which is for the adults. There's also a nonverbal Wechsler that exists out there. All three are accepted here at DDA for full scale, and the Wechsler nonverbal is one of our accepted nonverbal tests. I hope that answered your question in it. This is just continuing to go on about the WAC and regarding full scale IQ, the professionals that are required in order to be an accepted test: licensed psychologists, certified school psychologists, or neuropsychologists can complete IQ testing. No other professional is clinically capable of completing an IQ test for DDA purposes. It is important to note that we're aware that dual diagnoses exists in this world, and it's also important for IQ testing and adaptive testing to know that psychiatric condition does not impact the IQ or the adaptive. In order to be considered eligible for DDA to meet our criteria, the deficit has to have been due to the developmental disability and not the psychiatric disorder. I also want to throw out there, it's a hurdle that some of us have seen here at DDA recently when it comes to vision impairment or blindness. While we understand that professionals will say that there is no IQ test normed to individuals with vision impairment or blindness, we unfortunately in WAC currently have a statement, it's around this area right here, that does accept the verbal IQ score on a Wechsler. So we still do require IQ testing for individuals who are vision impaired or blind, because the WAC says that we can take the verbal IQ on the Wechsler. There is also a third way to a way around IQ, I guess is the way to say currently. And this is something that the professional would have to provide to DDA. If an individual's disability, so their developmental disability, is too severe for them to be assessed using a standardized IQ test, we can take a statement from that professional indicating that and then use that in lieu of a full-scale IQ score. But it has to be a statement that comes from a licensed professional. So this next slide is regarding House Bill 1407. This is something I referred to at the very beginning. It just goes, it goes over what happened about a year ago. About a year ago, the legislature passed this House bill and it expanded the eligibility past age 10. I do need to very much stress that this is not a federal change, nor is it a state change for every agency. It is a DDA change. And so the age 10 eligibility that other agencies have, that the federal government requires, that does not change. Long-term care still has their age 10 reviews. It only impacts DDA and how we look at eligibility under developmental delay. And so we are now able to serve individuals up until age 20 under developmental delay. Their eligibility will expire on their 20th birthday. And so the current way we're trying to prevent people from losing services is that when those birthdays start to come, that about 6 months out, we're going to send a letter saying, hey, you're going to expire. If you want to continue receiving services, then you need to reapply. And so that's how we handled age 4 expirations. It's how we used to handle the age 10. So that's how we're going to continue handling the expirations for age 20, in the hopes that people don't expire and can continue to access services. I think the highlight of having this change is that we are aware that sometimes getting diagnostics or getting those other things that are required for eligibility can take time. And so this allows people to maintain their eligibility, maintain access to services while working on those other requirements that DDA does have for continued eligibility. Okay. This is the WAC that goes over what is required under developmental delay. For an individual who is between the ages of 0 and 3, we require 1 or more areas of delay to be eligible for those DDA birth through 3 services. For anybody 4 and over, there needs to be evidence of 3 areas of developmental delay that are 1.5 standard deviations below the mean or 25% or more of the chronological age. I know that's a lot of technical jargon. When we're looking at testing, we look for a standard score of 77. Generally, that's what we're provided. And so that's kind of what we look for. The testing does have to be completed within 18 months of application date. So if I got the application today, and today is the received date, I only have 18 months prior to today to accept developmental testing. So a lot of education is happening by DDA to the school districts to let them know that this is the current requirement, in hopes that the assessments that they do at school time are being kept updated. So that way we can potentially use those to help people get access to services. Underneath that little yellow highlight right here, these are the 5 areas that we look at. So we do look at the physical skills, fine or gross motor, the self-help or adaptive skills, expressive and receptive communication. This includes American Sign Language, social emotional skills. And then we also look at cognitive or academic and problem solving skills. It's also important to note that the academic and problem solving skills is also a way to get around the IQ requirement for individuals who are applying under an OC condition. Oh, thank you. That's very kind of you, Teresa. Academic and problem solving skills are a way to get around full-scale IQ needs for anyone applying under the conditions of other conditions. So those chromosomal conditions, the neurological conditions. And so we can use academic delays as another way to equate to a cognitive deficit in getting them eligible, but then there is a review that will occur for that individual prior to their 20th birthday, but it's another way to find eligibility and if an IQ score does not exist currently. This just goes on more about the developmental delay WAC and the tools that we use. We do have, so one of the things that my lovely supervisor was able to get for us since she started with the team was a list of approved developmental testing. So we are not allowed to give out a list of things, of tests that we do not accept, but we can give out lists of the tests that we do take for developmental testing. And so that is a PDF that all of us have access to. I have given it to schools. I've given it to parents to provide to evaluators, whether that's at the school or even at outside evaluators. So private OT, outpatient OTs, speech therapists, physical therapists, ABA providers. We have a list of those tests that we can take for developmental delays, because there are times the schools do assessments that we don't take, and then it might be that one area that we needed to make somebody eligible, and because they did a test that we can't take, we have to deny someone, and that's terrible. It's an unfortunately terrible thing when a school does a test that we can't take. And so this slide, it goes over the professionals that we accept those tests from. It's not just schools. There are other professionals in our communities that can complete these developmental assessments. And this is a list of those. It goes on, I even think a second, nope, that's where it stops. Yep. So we also accept ABA therapists. That's not listed on this slide. It's not listed in the WAC, but as a team, we've made the professional judgment to say ABA therapists, it's what they're trained to do. And so oftentimes they'll do Vineland's or the ABAS as a part of their treatment, their therapy. And so we can take those as well from ABA therapists, but this is a list of the professionals. All these WACs are available online to everybody. I'm not sure if the links will work in the slide that you guys all have access to, but anything that's blue in this presentation does have a link attached to it to take you to whatever information was discussed. And so hopefully they work for you, because it's a good information. Our WACs, they'll be changing in the next year or so, hopefully. And so it'll be good to keep up on that information. So the developmental delay category also, it falls under the other conditions category. And so this WAC specifically refers to both the developmental delay and the other conditions category. And it defines what age you have to be in order to find somebody eligible under the other conditions category. And then it goes on to also tell you that number of areas of delay we require for the developmental delay category. And so, like I said, in order to be eligible for the ESIP program, for those early intervention services, the individual has to have one area or more of delay. For anybody over the age of 4 and over, they have to have those 3 or more areas of delay that we look at. All right. Reapplication. So eligibility, like I said, expires at ages 4 and ages 20. 4 is that time when individuals are transitioning from those birth to 3 services and are moving on to something different. And so we look at age 4 to see if an individual continues under the developmental delay category, or are they going to be eligible under one of the other 5 main conditions that we look at. Age 20, same thing, we're going to look to see if that individual has a diagnosis and the qualifying substantial limitations underneath it to determine if they can continue as a DDA client. At age 4, we're often finding, more often than not, under the current WAC, individuals are eligible under developmental delay still, unless their condition is epilepsy or cerebral palsy. We're often things like autism, intellectual disability, they're not often diagnosed because IQ testing is generally not done that young. It can be. If we do see it, it's possible, the tests exist, but we often find them eligible under developmental delay. And then I see a question, and that do they have to reapply? So yes, so both age 4 and age 20 expirations 6 months prior to that birthday, whether it's the 4th birthday or the 20th birthday, a letter will go out saying you're about to expire, you need to reapply so you don't lose your services, essentially is the very plain language that's in those. It's just a notice to say, hey, we don't want to see you lose services. Let's work together to make sure that that doesn't happen. And so the age 20 is a new thing for us. I'm not actually sure any age 20 expirations have gone out yet since that WAC. It's been about a year since that change. So we might start seeing some of those happen. I'm not entirely certain. But the age 4 ones, we're on the ball with that. We've been doing that for a long time. So, but it will be the same for age 20. There will be a contact made by us, and then it does fall on the hands of the individual and their support system to make sure that they're reapplying so we can work with them to maintain their eligibility. Person, you have a client that applied at age 19 but wasn't approved until age 20. Will they have to reapply? So if they were approved under any other condition outside of developmental delay, no. So when an individual is found eligible after the age of 16 under any of our 5 main conditions. So outside of developmental delay, if they're found eligible at 16 or older, their eligibility is permanent. And as long as they maintain their residency here in Washington state, there will be no reviews. I do say that with some caveats because we all know WAC can change. We do currently have some older adults who will come back to us who were made eligible prior to June 1st of 2005. And we had a WAC change before I joined the team. I don't know the exact date, that if an individual was found eligible for DDA prior to June 1st of 2005, we then have to review their eligibility to make sure that they still meet criteria in order to then enact services, start services with them. And so there should not be any need to reapply if somebody was just recently found eligible at the age of 20. They should maintain their eligibility. Nanette, when you say need a new evaluation, can you specify what you're referring to for me? Because if it's an evaluation like for a diagnostic purpose, it would just depend with IQ. So adaptive more than likely. So adaptive assessments are only good for 36 months for our purposes. And again, with the WAC changes coming, I can't guarantee that that won't change. It's currently, if somebody applies today, I can take an adaptive score that was done between April 24th, 2021 and moving forward. So yes, it's very likely that we would need updated adaptive with the IQ going away. I don't know how to answer that specifically because IQ will not be used to disqualify in the future. So if they expire sometime this year and they have gotten a new diagnosis, but the IQ has before age 20. So no, sorry, I'm trying to think about it because I have never been asked this question before, Nanette. I apologize. So technically our WAC says, the current WAC with requiring IQ, that if the individual is under the age, so under the age of 20, so 19 and younger, the IQ can be completed at any time and we can accept it. If the individual is already 20 years old, then the IQ has to have been completed at age 13 or older. And so if the individual is reapplying prior to their 20th birthday, when they get that notice, then their IQ was done at say age 12, then we would that IQ would totally be good. It would be completely acceptable. If they would wait till after their 20th birthday to reapply, then we would need a new IQ as the WAC currently stands. Did that make sense, Nanette? I apologize. My brain had to catch up on that one. Okay, so Elizabeth, you're asking, how would you evaluate a male born in the US, raised by an aunt in Panama, returned to the US with never having a diagnosis from a doctor, but whom was diagnosed with autism by the Yellow Brick Clinic at the age of 35 after returning to the US? Good question, Elizabeth. So Yellow Brick Clinic is one of our Center of Excellence providers. So we accept autism diagnoses from Dr. Kathleen. They do not do IQ testing. So that's the only caveat to Yellow Brick Clinic, is that she is not able to complete IQ testing. She often does do adaptive testing, so that's always a plus. With regards to evaluations that they complete to diagnose autism or confirm a diagnosis of autism, we read the evaluations. We look for references to, did the individual receive special education services? Is it noted that there was developmental delays in social, emotional, and communication when they were a child? So we look for all these little pieces of criteria to see, did this exist prior to the age of 18? Is there evidence that the onset was prior to 5 with regards to autism? Yellowbrook Clinic is great. We get evaluations from her all the time. It's the IQ piece that she is not able to do for autism specifically. That is still a requirement unless there is a statement by a licensed professional that says that the individual is too severe to assess for that IQ score. Does that make sense, Elizabeth? Did I answer your question? And Pam, you're asking, we have a client in her 20s who recently was sent to UW for genetic testing to see if she has markers for DD so she could qualify for DDA. Do you know if this test gives a clear indication of eligibility? Are there certain ranges for possible eligibility? Are you talking, Pam, are you talking about genetic testing itself? So when it comes to genetic testing, so here at DDA, we actually have like a database that we have access to of approved conditions. Genetic conditions can fall in there. If it's not listed in that database, we can submit it for review by our licensed psychologists and medical professionals that we have to see if it meets criteria. Any condition that we accept at DDA has to have evidence of intellectual deficits as well as adaptive skill deficits. And so when it comes to genetic testing, we need the actual genetic condition. And so oftentimes we will get genetic reports submitted to us. And while I like to think I'm an intelligent person, I cannot read a genetic report for the life of me. I get them all the time, and I often have to go back to the individual's physician or family and request that the physician just write me a statement about what the genetic condition is, because there's so much medical jargon in a genetic report itself that I can never pick out what the actual genetic abnormality or deletion or duplication, what it is, in order to see, is it already existing in our current genetic list, or is it one that I can do the research and submit to see if it can be approved as a condition? And so it's knowing what the exact genetic condition is in order for me or someone on the team to submit it for approval or determine if it's already approved. Let me know if that answers your question, Pam. You're welcome. Elizabeth, so when it comes to, so you said, however, we have no information on his time in Panama. If I were handling this case, my question to the individual applying would be, is there somebody from his childhood, whether it's a family member or somebody who had, because there is an exception in WAC that says that we can get, if we've tried everything, if there's nothing that exists in physical documentation, we can get, so to say, an attestation from somebody who knew that individual in their childhood prior to the age of 18, before 5 for autism specifically, to get verbal attestation that there were delays that existed. That is a current requirement in WAC that unfortunately we don't have a way around needing the evidence to show that that condition existed prior to the age of 18 as well as onset. So saying that the diagnosis existed prior to 5 as well, for autism specifically. And if we can't get that, then that is when we would link that family to home and community services, because unfortunately that is a requirement. And home and community services does exist. It is available to adults with disabilities. They provide similar services. I know it would probably be a very frustrating answer to the individual and their support system. But if we can't even get somebody to provide us with a verbal attestation as like, yes, this individual did have social delays and communication issues prior to the age of 5, like that existed, we wouldn't be able to meet all the requirements of WAC. Does that answer it, Elizabeth? All right. Okay. So with expirations and reviews, there are some outside of the expirations, we do have reviews for individuals too. So if an individual is found eligible under any of the 5 main conditions before the age of 16. So if somebody comes in and they're 15 years old, we find them eligible under cerebral palsy, intellectual disability, or any of the others. they will get reviewed at age 19 prior to their 20th birthday. And so generally, the families don't really know this is happening unless we need an updated consent form or documentation. We get assigned individuals every month. We review their cases. If we need additional information, we reach out to either the family, or if we have consent, the school or a medical provider. Generally, it's just adaptive testing. Usually, if the individual is found eligible, we already have diagnosis, we already have IQ. And so generally the only information we really need for most diagnoses is the adaptive skills score, and for cerebral palsy, the evidence of the physical assistance needs. If we're provided that there is evidence of insufficient, mistaken, or fraudulent information, we can review an application. That's not something somebody at my level determines. That's above my head. And I've never actually seen that occur, but it is a possibility. We have a medically intensive children's program. So those cases are reviewed prior to the 18th birthday, because that is when that program ends. And then, like I mentioned earlier, the academic delays, if the individual is found eligible using the academic delays in lieu of IQ, then they are reviewed prior to their 20th birthday to make sure that they still meet criteria. Terminations occur if an individual moves out of state. That's one that even when I worked in Pennsylvania, families would often be a little shocked that things do not transfer from state to state. They do not. Our waiver, our developmental service programs are state determined, and so every state is a little bit different in their eligibility requirements and how they use the funding. So if you move out of the state of Washington, the eligibility is terminated, and if you would move back, you would have to reapply. The only other way to terminate outside of somebody passing away is to ask to be removed from DDA, to tell us that you no longer wish to be a client of DDA. All right. There are 3 regions in the state of Washington. So region 1, those are the counties for each region, region 1, region 2, and region 3. We all have our own IE inboxes and phone numbers that can be called for IE questions, application questions, to get applications sent to you. Those are phone numbers and email addresses that you can reach out to. We do have language support here at DDA, whether that is actual physical documents being translated. We also have access to translation services in several different formats. On the phone, in the moment interpreters, we can also schedule appointments with interpreters, whether that be through DDA uses Microsoft Teams. That is our approved video meeting platform. And so we use a translation service to also participate in those meetings with us, as well as phone calls and in person as well. We also have translators who can come with us in person. And so all of our forms, as seen on the screen, can be translated, and we can forward those to you through email, through mail, or even through the Adobe that we now use electronically. So what's next? Someone's found eligible for DDA. I&E makes that phone call. We call families. We go over this entire spiel. We tell you you're eligible, whether or not there's a review or an expiration. We'll let you know what condition you're found eligible under. We'll talk about your appeal rights. Everyone has a right to appeal for the most part. There's only a very few things that do not allow for an appeal. And then if the individual is interested in services, we talk about services and what comes next. If they're not currently interested in accessing services, that person goes on the no paid service caseload. It's a caseload of individuals who are eligible to receive DDA services, but have not currently requested anything. We have case managers now. We got funding, was it last year maybe, to expand our no paid service caseload. So we have case managers. It's not fully, they about have 300 to each of them. So we're working on getting those caseloads loaded and taken care of. But if you're on no paid services, that means that case manager will reach out to you once a year to check in and see if you're interested in receiving DDA services moving forward. And if not, they'll just keep reaching out to check in to see if you are, and they're there at any time if that changes for you. However, if somebody's found DDA eligible during that I&E call with the family, then what comes next is a service request. It can be entered by the family. I highly encourage anybody who is getting an eligible phone call to ask your I&E worker to enter that request for you, for several reasons. One, we do them regularly, so I can get one entered within a matter of seconds. It takes me very little time to enter it because I do them all the time. And then 2, because the moment that is entered starts your wait. If you wait to put yourself on that list, then you wait to wait. So getting on that wait list sooner shortens your wait than if you would wait to do it yourself. So I'm more than happy to do it. It still gives people time to review any information that we send out when we do send out the notices of eligibility, because that call is not going to happen within a few days. It's probably not going to happen within a few weeks. We currently do here in Region 3. I cannot speak to Region 1 and Region 2. In Region 3, we have a little bit of a wait time. So every region is a little bit different in that. So if you're speaking to your friend who lives right over the county line in a different region, they might have a completely different experience because things are done a little bit differently from region to region with regards to staffing and numbers of clients that we have and all those fun things. But once the service request is entered, it gets put on a wait list. It gets staff gets notified. They notified the no paid service caseload, and then that person will eventually reach out to get going with the assessment. And that assessment is now being done in home with the individual and their support team. This slide shows the region context. So here in Region 3, Doreen Vandervoort is my supervisor. Above us in the northern half of Western Washington is Shane Lucy. And then in that very large chunk that we call Region 1 is Donette New. She covers pretty much 3/4 of the state. So those are their contact information, their email addresses, and their phone numbers. Do I need to leave this up for a little bit for anybody, or can I keep going? I can always come back to it too. Okay. All right. Karina, 5 minutes. Good call, Luke. All right. When clients need to move the guardian request a packet to be sent to another facility, what is the response time? Can you clarify a little bit more, Karina, on what you mean by that? Thank you, Elizabeth. That's very kind of you. I love my job. I hope it shows. I love what I do. I wait for a little clarification, Karina, if you can give that to me. I just want to note that this page has resources on it for the eligibility itself. It'll take you to the application documents. The second link takes you to that service request and information page. And then that bottom DDA policy is the policy that we follow here at DDA when it comes to intake and eligibility itself. And our program manager is currently Will Nickel. That will change in the future. So if that name isn't always ringing a bell for people, it will be changing at some point. Karina, you said we asked a packet to be sent and it disappeared. Disappeared as in it didn't make it to you? Like you requested that it be mailed and it didn't make it to you? So some of these other pieces that are in this slide while I wait to hear back from Karina is Informing Families is a really great resource. If those of you that are sitting here with me today aren't aware of what Informing Families is, I highly recommend giving them a look. They have a website, Informing Families does, and they are a partnership with us and the Developmental Disabilities Council. We pay for them to put out resources and information about these the DDA and what we offer and other resources within the community for individuals of different varying ages. They're really great. And so they do have some DDA relevant documents that are available also on their website. And so this one is just the waiver eligibility roadmap. So this is once somebody is already eligible for DDA. Karina, that sounds great. I would love to talk to you one-on-one more about the issues that you're having. But this just goes over like when the service request happens and the steps that come afterward. Just when you're DDA eligible, there is an assessment that's done. It determines your functional eligibility for the client. Does that client meet functional eligibility? So where are they at developmentally? And then after that's determined, yes, they are, then there is a financial piece that long-term care manages. That is not done through DDA. It is done through long-term care. That is a huge misconception, I guess you could say, in the community, is that we handle long-term care's financial side. We do not. We are separate agencies. They do it for us and let us know when somebody's financially eligible. Community First Choice is a really great Medicaid entitlement. So this is a personal care service available to adults and children here at DDA. Adults can only receive this service if they are open on a waiver with us. Otherwise, this service can be provided to adults with disabilities by Home and Community Services. And this page is also available through the DDA website. It just goes over what CFC is and some of the other things that are available under that service option. And then this is also available on informingfamilies.com. It goes over the 5 waivers that we currently have at DDA and some of the services that they have. And then there's some more links and resources for you all. Karina, I usually ask it to be emailed to me as guardian, then forward it to the facility. Usually takes. That's a really good point, Sharon. It might be super beneficial to have the application sent directly to whomever the guardian is. I don't send out applications myself. Our support staff do that for me. So I'm not sure how it works when it's requested to be sent to a facility. And thank you, Linda. I hope it was informative. If anybody else has any additional questions that I did not answer, I'd love to either talk to you directly. My contact information can absolutely be provided. Or I can answer them now in the last minute that we have.
All right. Thank you so much, Amy. Really appreciate you.
Yeah.
And thank you everybody else for being here. And that's the wrap on the conference. A couple things. As far as the attestations go, if you could get those completed by this Sunday, I'm going to be submitting them on Monday. And so if you could, like right now, go into your email address or email inbox, that's the word I'm looking for, and just go there and fill it out. It's going to take 2-3 minutes to fill it out, and then we'll go ahead and submit that for you next week. And then again, if you're an attorney looking for credit, make sure you do that. Go under the surveys button. But thanks for being here this year. Hopefully you can join us at one of our coffee chats soon. We got a bunch of new people joining our mailing list, and so we'll make sure to send out monthly emails to keep everyone connected and look into some more ways to for networking and connection amongst Washington State Guardians. So really appreciate you all, and wishing you a good year.